The Healing Communities study is testing the integration of prevention, overdose treatment, and medication-based treatment of opioid use disorder in select communities hit hard by the opioid crisis. It investigates how tools for preventing and treating opioid misuse and opioid use disorder can be implemented most effectively at the local level. Dr. Craig Lefebvre from RTI International describes how common, evidence-based practices can be adapted to local conditions through targeted communication campaigns.
So just a bird's eye view, there's three major pillars to what happens in the communities that heal intervention framework. The first is the coalition-driven and data-informed process. That's the core of our community engagement approach. Overdose education and naloxone distribution, MOUD delivery, and safer opioid prescribing practices are the three areas where we focus on evidence-based practices in each of these communities. The communication campaigns fit into this by first being informed by the data and the community engagement process. We do use a community change and community informed process to develop these campaigns and implement these campaigns, again, to increase demand for evidence-based practices and to reduce stigma. I'm going to take a deeper dive into one community first, just to kind of show you what happens on the ground. Gloucester is one of our intervention communities. Fishing industry is very important to this area. Next slide. But in Gloucester, one of the problems that was identified by the coalition is that the fishing community there is an underserved but also high-risk population. Almost a quarter of all the opioid overdose deaths in a 4-year period occurred among people in the fishing industry. There's also the barrier of a lack of insurance due to the seasonality of the work these fishermen do. And the solution that was generated by the coalition and implemented was something called Provider on the Pier, which was the idea of a basic medical clinic that also specialized in MOUD and OEND to serve specifically the fishing community. So this medical clinic is located in the Harbor Master building on the pier. As you can see on the right, this was one of the promotional pieces where basic medical evaluations, connections to primary care providers, but importantly, enrollment and medication for opioid use disorder and naloxone and harm reduction services were offered. With this in place, part of what we did with the campaigns is to focus specific parts of the campaign messaging on the fishing community. These are images of local fishermen who volunteered and gave their permission to be photographed and used in these ads. And what we find is that the idea of localizing our advertising and also reducing some of the stigma around the use of medications to treat opioid use disorder comes across more clearly when we've got people from the community and of the community involved in this campaign. We have 4 campaigns that we've implemented in these communities. The first one was naloxone. The second was around reducing stigma, seeking MOUD treatment, and a 4th campaign, staying in MOUD treatment. In each of these campaigns, starting at the top of this pyramid, we developed centrally and through the communications work group a cohesive set of communication objectives, who the priority groups would be, and what the core strategies and tactics will be that can be applied across all the communities in the HCS. Each of these 4 campaigns integrates approaches to reducing stigma. We also then provide them with various documents and samples of ads that are then taken by the community coalitions and tailored to unique characteristics of each community. As I showed you in Gloucester, for example, the idea of using local models and local imagery when they're producing their final campaign materials. And we also increase community engagement and the adoption of the evidence-based practices in each community by integrating this with what is also going on in those other 2 parts of the CTH process. So what we're finding is that communication campaigns do show some evidence of reducing stigma and supporting EBP adoption. That building communication planning into community intervention should start at the very beginning. Said several times now, the importance of customized and localized materials that also consider equity. And finally, understanding local cultural stigma and barriers we're finding are all key to success in developing successful campaigns.